Hi there, welcome back to my channel. My name is Erik Schabert. I'm a doctor of osteopathic medicine with more than a decade's experience in family medicine and osteopathic manipulative medicine. Please, if you're tuning in for the first time, don't forget to hit that subscribe button, and please like and comment if you find this content useful to you. It really helps me get my channel out to more people. All right, so this afternoon, I'd like to discuss something that's become a bit of a controversy in online media in the past several months and maybe even several years, and that is how much protein should we be eating? High protein diets have definitely become a lot of the rage, and we've started to see some pushback with individuals saying, hey, that might not be the best way to go. So I'm going to try and sort through all of the data that's available now and see if we can come to some kind of consensus on what sort of dietary input would be best. All right, and first off, I think I want to kind of front load an idea here that simplifies everything to an extent. There's a lot of advice you'll see from physicians on what kind of diet should be consumed with regards to maybe a Mediterranean diet or a vegan diet or a carnivore diet. What I think really should be the goal here is to try and find a diet that hits as many of the major macronutrient goals as we can hit. First off, what kind of diet can you eat on a long-term basis that will result in your calorie intake being at a level such that you can get to pretty close to an ideal body composition, where you have a little bit more on the side of lean body mass and less fat. So trying not to get too many calories is one of the keys. Additionally, with that, we also need to try and hit 20 to 30 grams of fiber intake daily, and that means a substantial amount of fruits and vegetables. Along with that, we also do need enough protein that we can support our muscle structure so that we maintain strength, balance, and function as we age. So what exactly does that mean? Well, the USDA has a recommendation for 0.8 grams of protein per kilogram of ideal body weight. And that's a number that probably doesn't mean a whole lot to many of you out there. So let's break that down a little bit. First of all, when we're trying to calculate ideal body weight, there are a number of good calculators out there. But to give you an example, I'm about 5'11" tall. And for me, an ideal weight calculator comes up with a number of around 77.7 kilograms, about 78 kilos, or 171 pounds, a number that will be more meaningful to most of you out there in the United States. And so when we're talking about the targets for protein intake for somebody who weighs about what I do, let's go a little bit higher and go to 80 kilos, nice round number, which is going to be about 176 pounds. There's about 2.2 pounds per kilogram, just to give you an idea of the conversions. And at 80 kilos and 0.8, assuming 80 kilos is my ideal body weight, 0.8 grams per kilo is going to come out to 64 grams. And again, to give you an idea what does 64 grams of protein look like, a cup of almonds, so like if you took a 1 cup measure, filled it to the top with almonds, would be about 20 grams of protein. And you'd be looking at about 56 grams of protein in an 8-ounce steak. So that gives you an idea what we're talking about when we're talking about specific amounts of protein and what we're trying to eat. Now, there are quite a few people out there, experts in the field really, who have ideas that consuming a good deal more protein than what the USDA recommends may be helpful. And an example of that would be Dr. Peter Attia, who is an MD and is considered a bit of an expert on longevity and aging. And while I don't agree with Dr. Attia on everything, he does have a lot of very strong ideas that are well-founded in evidence-based research. He recommends 2.2 grams per kilo of ideal body weight. But now he is also recommending some pretty aggressive resistance training regimens along with that. And I do think the amount of activity matters when we're trying to dial in exactly how much protein we should be eating. Dr. Rhonda Patrick, a PhD nutritionist and another expert in the field, recommends 1.2 to 1.6 grams per kilo of ideal body weight and varying that based on activity levels. I think that's a fairly reasonable place to come in, especially when you consider that exercise, and not just cardiovascular exercise, but resistance training as well, are some of the most powerful forms of medicine that we have to prescribe for our patients. There is nothing that is more potent than exercise when we talk about prevention of cardiovascular disease, prevention of dementia, cancer, and certainly prevention of falls that lead to fatal outcomes. So this is something we have to keep in mind. And certainly one of the big things that we are concerned about when we start to think about protein intake long-term over the course of the lifespan is the idea of fall risk and sarcopenia, or lack of muscle and strength in our elderly population. Because having too little muscle, losing too much strength, and becoming totally frail is something that is going to have more potential to negatively impact both quality of life and lifespan as we age. So I think protein intake becomes very important because of that. Now, one of the other things we have to take into consideration are some of the ideas that have come up over the years on the negatives of consuming too much protein. One of these is that excessive protein intake can raise urea in the blood, and that can overload the kidneys, causing kidney damage. But research has shown that if you have healthy kidneys, or even kidneys that are in the very earliest stages of renal failure, this simply isn't true. And it's not until you get to stage 3 kidney failure, or of course stage 4, where you require dialysis, that we really need to restrict protein intake for health reasons. Additionally, Dr. Walter Longo, an interesting name, is someone who has done a lot of research with regards to cancer and cancer prevention through nutrition. And he has become concerned because in animal models and in the lab, the consumption of animal protein raises some serum markers associated with excess growth hormone and growth hormone activity that theoretically could contribute to increased cancer risk. He published a long-term longitudinal study looking at human beings and protein intake from age 50 and beyond, and equating that to cancer risk. And there was a finding that consuming more than 0.8 grams per kilogram of ideal body weight of protein did indeed increase cancer risk over time and cancer mortality, at least from age 50 to 65. Although after that, we saw a reversal of that trend where cancer risk and mortality actually went down the more protein you consumed. This was something of an odd finding, and it does call the earlier finding into question. And a deeper analysis of the data from that study showed that if you actually factored in calories, because in this particular study, caloric intake went up as protein intake went up. And when you normalized for that additional calorie intake, you actually saw the cancer risk almost entirely evaporate. And that really makes me think that the issue that was causing the increased cancer risk was not an increased intake of animal-based protein, but was instead an increased caloric intake along with that animal-based protein that resulted in excessive weight and therefore increased cancer risk. As we know, obesity is a major risk factor for multiple cancers. Additionally, in that study, individuals who consumed higher protein diets but were focused on plant proteins did not see the associated increase in risk. But I really do believe that is because those diets Also, the high protein plant diets did not result in more excessive caloric intake. Now, along with that, we have results of the Nurses' Health Study out of the United Kingdom, which showed that increased protein intake was actually associated with a lower cancer risk. But in that study, the individuals consuming the higher protein diets had lower daily calorie intakes and were much more likely to exercise. So those are confounding factors that, again, probably take protein out of the equation. I think the bottom line with this is, as I discussed early on in this video, that we need to focus on having a caloric intake that leads us to a healthy body composition, while at the same time consuming enough protein to make sure that we can get anabolic effect from exercise we are doing that has the potential to build muscle, because we're going to need that muscle as we age to avoid all kinds of health issues. All right, so I think that covers the majority of what we are looking at here. So I think that it's safe to say trying to get calories from plant-based sources can certainly be helpful, but making sure that we get enough protein overall, whether it's from animal or plant-based sources, is really the key. And I do believe that that 1.2 to 1.6 grams of protein per kilo of body weight is really where we're going to dial in well for most people. Certainly, if you're someone who is aggressively doing resistance training, going above that may be helpful, and you can play with higher protein intakes. And as long as you're not beginning to gain fat, there isn't going to be any harm in that, and there may well be benefit. I think that's the best information we have right now. Well, once again, if you found this information helpful, please do like, subscribe, and share this video, as getting it out to more people certainly helps me continue to do this and will help those individuals who need this information. Thank you so much. Remember, the intent of this channel is to get you information that allows you to make healthy decisions and to have informed discussions with physicians and other health practitioners in your area to keep yourself moving. I do hope to get into a little bit more information on exercising for mobility and balance as we age, as I did reference that as an issue earlier in this video. And I do expect to have a video upcoming on that in the next several weeks. Please keep tuning in, and thank you so much. This is Erik Schabert, and I will see you next time.